So we're talking about EHRs today. They've been around for many years. It's no longer the large or academic medical centers that are implementing this technology. There are a number of solutions that are targeted towards organizations, such as small single doc practices, as well as large organizations that have a lot of ability to customize their content. So ARA has definitely accelerated and expanded the EHR implementation efforts with the associated incentives. I was actually, while we were here, I was looking at the revised meaningful use matrix, and the definitions continue to support incentives for adoption and use, not just implementation of the technology, and I think that's key. I don't see that changing, and I hope that focus continues to remain. That's where this panel comes in. Many of the organizational stakeholders, patients, providers, nurses, physicians, others have limited experience with EHRs. So it's imperative that government, provider orgs communicate effectively with their constituents to educate and engage, to have these successful implementations and drive adoption. So that's where this panel is focusing. Get started with Lygeia.
Thanks. Should I use this?
Yeah.
Okay, excellent. So by way of just a bit of background, my name's Lygeia. I've worked on health IT as well as other applications of technology for learning for about the past 15 years in both the public and private sector. A couple years ago, I set up my own private consulting practice called Clear Voice Consulting, and have more recently joined with this merry band of folks in the group called Clinovations, which Anita was just telling you about. Since we are the last panel today, I wanted to harken back for a second toward the first speaker's remarks, Craig Stoltz, in a couple of ways. One is he made the remark that you do your very best work when you're just a little bit hungry. So as we approach the lunch hour, try and stick with us, keep thinking about it. The other point is sort of the spirit of some of his remarks, which was a little bit in the vein, I'd say, of pushback. Not that social media isn't incredibly important and valuable, but that it's not the be-all and end-all of everything. It's sort of a mix of old and new that we need to think about. And certainly Patricia Hinton-Walker and others have alluded to that point too. So, it worked on the iPhone, folks. Okay, so technology changes things. We've got a medieval manuscript here and some modern books. Back in 1440, Gutenberg invented the printing press. Did it change things? Yes, the spread of ideas dramatically increased, but that certainly was a number of hundreds of years. And I might add, not only has it sort of changed the way information is spread and thought about and access to information, but it hasn't been a complete shift in that I noticed some folks even today sitting out there in the audience with pens and paper. So there are the right places and the right niches for each kind of media. Nevertheless, as you've certainly heard today, social media is obviously going mainstream. We've talked about some examples in particular niches and parts of the government, for example, in the private sector. But just some general data for you guys. Baby boomers are embracing popular applications, social media applications, 20 times faster than kind of the youth media market. So this isn't all about, teens and your grandchildren or your kids. Also, numbers of Twitter profiles have been, or other online profiles, not Twitter profiles, but like Facebook and other social media profiles have gone way up. Back in 2005, 8% of adults have them. In 2009, 35% of adults have them. Twitter use did increase more than 1,000% between February of 2008 and February of 2009. And as you know, health-specific social networks of various sorts, including those for physicians, such as Osmosis, for general communities, or condition-focused sites for patients, are also proliferating as well. So if you're sitting there within, whether it's a government agency or a company or whatever sort of organization you're in, you're sort of going, oh my goodness, this is overwhelming. Do I try and do everything all at once? How do I make a decision about how to strategize before I just kind of leap? It can be a little bit intimidating. And I think some of the key questions to ask yourself are, number one, what are your overarching goals? I mean, certainly if you're looking at something like getting information out in a very time-sensitive way, it may be appropriate to use a vehicle such as Twitter. If you're looking at something that's incredibly complex and involves a lot of diverse stakeholder input, it might be a part of your strategy, but certainly probably shouldn't be the sort of underpinning piece. Who is your audience? Again, there are different demographic groups with different literacy levels, not to mention health literacy levels, as well as different comfort levels with media use. Again, on our panel, there are different comfort levels with media use. Ted, again, is probably my mentor as well as concerns about privacy and trust. And so, again, I'd sort of urge you to think about how to weigh different old and new types of media or modes of communication in making decisions. And another key point that's come up today in a number of discussions is the importance of managing your social media communications. And, obviously Andrew Wilson has part of that role for HHS. It's so important for an organization to identify somebody who's thinking about and responsible for all this. It's not just sort of you blog in your spare time or you'll Twitter or whatever. I mean, it takes a lot of time and a lot of analysis. And I write a blog actually for the Robert Wood Johnson Foundation's Project Health Design. And it's a PHR, personal health records program, and it's been very interesting for me and for them, I think, to learn this process of how do you decide, what voice is appropriate for a set of institutions, a big foundation and an academic institution that are knit together in this particular situation. Is it okay for me to write things totally unvetted that sort of have their name on it? And these are a lot of things you have to think through, not necessarily that you have to have the grand plan all mapped out ahead of time, but you have to assume that you're going to have to talk about it and evolve a lot. So, quickly want to take you over to New York State, which is a state I've been working with for a couple of years now. It's spending more money than any other state on trying to get health information technology flowing, working, up and running. The way it's going about it is in building 12 different regional health information organizations and linking them all together via a statewide network. They're spending about $200 million roughly on health IT. Again, more than any other state, and more is coming through with the ARA. Whoops. Uh-oh. Ted? This one's just not changing.
There's a remote up there right in front of you.
Okay, see? Old media.
Okay, wait, now you're on New York State.
Okay, can we go one more?
There we go.
Beautiful. So the way that they've done this, again, a lot of this takes a lot of really in-depth work. They set up a public-private multi-stakeholder organization, which they incorporated a couple years ago, which its entire job is to kind of coordinate people in the task of making these grants to the regional information organizations work, defining technical specifications for how they're all going to talk to one another, and a very important part of the job is defining new health IT policies. And that takes a lot of input. On top of all that, they're trying to engage providers and patients about health IT and how they should be involved. So, they've done a lot of the old school stuff, a lot of meetings involving more than 200 stakeholders, phone meetings, email discussions. They've also used some new platforms, like an online community for discussion, something called Central Desktop. I don't know if you guys know it, but it's sort of like this online workspace where folks from all over the state and people like myself from outside the state can weigh in and sort of have structured discussions about very complex topics in a way that's more organized than just sending emails. In terms of more the sort of outreach side to providers, there are specific webinars on EHR implementation as well as other web resources. And for consumers, we've really been using a big mix. Again, in the old media world, posters, brochures, radio spots, websites, all sorts of other things. We can keep going here. Those are just a couple of examples of some of the things we've used. In the future, we're talking about using a lot of other things like tapping into existing online social networks, doing a YouTube animation to explain how all this health IT stuff works, viral marketing, mHealth, and other things. But the point is, not every organization is going to be able to do the kind of stuff that some have, and that it's a matter of really trying to find what is specifically right for you and your charge or your challenge. So, final thought, some of you may remember back to 1981 when MTV launched, and its very first video was Video Killed the Radio Star, and I'm not personally media savvy enough to have the link right there. Well, I do have a link, but I'll spare you. But the point was, it was a nostalgic song about how the kids of the 50s and 60s are never going to appreciate the kind of radio current kids wouldn't appreciate the sort of heritage of music that other kids had. And honestly, I think that's turned out not quite to be true. Obviously, video has added a lot to our lives, but it hasn't sort of overrun radio. So again, underscoring this point, use the old and the new together.